Good afternoon to everyone here. We want to thank you on this very warm day for coming out for the Northeast Indiana Disability Advocacy Coalition Disability Forum. I would like to say just a couple of housekeeping issues. I want to thank Kathy Cortopassi for doing the real-time captioning for us, and thank the interpreters from DeafLink for coming and providing the ASL interpreting, and Richard DeReamer for being our timekeeper today. Also, I want to thank Lighting and Brewing for making available to us complimentary parking in the parking garage. But more importantly today, I wanted to just speak to the candidates for 1 minute and to let you know that there seems to be an attitude anymore of candidates not really wanting to interact with the constituency, and we feel very, very honored that so many of you wanted to come and talk to us about issues that are so important to us. So I want to give you a hand, first of all. Thank you. I'm going to introduce to you now, I don't think I said so, but my name is Sherry Pavetta, and I'm with Fifth Freedom, one of the organizations in the coalition. And now I'm going to introduce to you David Nelson. He's the president and CEO of the League for the Blind and Disabled, and currently the chair of the coalition. Thank you. David?
I also welcome everybody and thank you for coming out. No coalition chair would be doing his job if he didn't explain who the coalition is and make sure you're aware of some of the things that we do, including this forum, which these folks have so graciously offered their time to participate in. The Northeast Indiana Disability Advocacy Coalition was formed in 2008, and our first activity was to do a forum for 3rd Congressional District candidates. From there, we started hitting public education through the Abilities Abound event. That's happened every year since 2009. In 2010, we published what was the third ADA, Americans with Disabilities Act, report card for 2010, the 20th anniversary of the ADA. And currently, we have a voter education project going on. There's a booth right out here. This project is designed to establish a database of about 5,000 or more people who have interest in disability issues in Northeast Indiana, determine the positions of candidates on some key issues that we're tracking, educate those 5,000 interested people in where candidates stand, and then get out the vote. So if you have not signed up to be part of the disability or part of the voter education project, please take time to do that today. So we are coming to you as a group that has 14 members, 14 agencies. These agencies serve thousands of people every year, and this coalition is active and growing. With that said, again, welcome to all of you. Thank you to all of the candidates for taking time to be with us today. And I now have the pleasure of introducing an advocate and a board member of Fifth Freedom, Ms. Carrie Boyland, who will serve as our moderator today. Carrie?
Thank you. Again, thank you all for coming. I'm going to tell you a little bit about how today's going to work, and then we're going to get started. The forum is divided into 2 parts. The first portion, each candidate will be allotted 3 minutes to explain and share their information about themselves as well as their ideology. The second part of the forum will be for question and answers from the audience and myself. So let's get started, and David Ober, 3 minutes about yourself.
Thank you. It's a pleasure to be here today. My name is David Ober, and I am a candidate for District 82 State House. I am a Republican, and that district covers all of Noble County and portions of Northwest Allen and Smith Township and Whitley County and LaGrange County, as well as part of Elkhart County. It's great to be here today to talk to you about your issues, and hopefully you'll be able to get some answers so that you have a very important decision to make this fall. I said I'm a Republican, but more importantly, I'm a conservative Republican. My ideology supports that. I believe in smaller government, more local government, lower taxes, and all these other things that you hear other leaders speak about. But I will take the rest of my time and allow some of the other candidates to introduce themselves.
Okay. Mr. Martin Carbaugh.
My name is Martin Carbaugh, tricky name. And I'm running for the 81st District, also Republican. Born and raised in Fort Wayne area. My district, the 81st District, will cover mostly all Fort Wayne, west of Clinton, and then we pick up a little bit of the county on the far west side. The Disability Forum, thank you so much for allowing me to come and talk here. It hits close to home. I've had family that have benefited from disability programs. I've had friends and co-workers that have people using the services that the state provides, and I find that a very important thing that we continue to support those truly needing the services. Thank you.
My name is Kathy Heuer. However, my husband grew up as Jim Heuer. The pronunciation is the German pronunciation. I respond to both, so you really can't mess it up. I want to thank you all for inviting us here today. I am the representative right now for District 83, which currently includes portions of Noble, Whitley, and Allen County, but will soon be, after the next election, just Allen and Whitley counties. It will include in Allen County all of Avoyt Township and a little sliver of Wayne Township. So again, we thank you for having us here today. Currently at the state level, I serve on the Education Committee, along with Local Government Committee and the Commerce and Economic Development Committee. During the summer, we have committees that meet in Indianapolis while we are in the interim, actually in recess. And one of the committees I asked to be able to serve on this year was autism. I don't know that much about autism, and I thought it would be a great introduction for me into some of the world, a very small part of the world of disabilities. So I'm anxious to start learning about that. I've taken the opportunity this summer to visit with ARC. Phil and I, Representative GiaQuinta and I were at Turnstone for a day this week to take a tour there. And we'll be visiting several other organizations, mostly in Allen County. Passages in Whitley County, if any of you are familiar with Passages. So once again, I just thank you, and I look forward to our conversation today.
Representative Phyllis Pond, you're next.
Thank you. I want to thank you for having this forum. It's very important for you to have a forum where you can ask us these questions. My district, my new district now is all of East Allen County, from about Anthony Boulevard to the state line, down to the Monroeville Road, and up to the DeKalb County line. And my district did include parts of DeKalb, but it now is all in Allen County. In the legislature, I serve on the Ways and Means Committee. Those are the ones that kind of hold the purse strings, so that we allocate the money then to the resources that we need them. I also serve on the Judiciary Committee, and I have 3 grown children, 2 grandchildren, and I taught kindergarten in East Allen for over 30 years. So there may be somebody in the audience that was in my kindergarten class. It's hard to go anywhere, whether it's out to eat or gas station or any place, where people don't say, hey, you were my kindergarten teacher. I hope they say it fondly. We have summer study committees which study the issues that will be coming up the next session. I serve on the Child Support and Child Custody Advisory Committee. They meet 2 or 3 times in the summer, and also the State Fair Advisory Committee. And I'll just be glad to answer any of your questions. Thank you.
My name is David Long, and I'm the senator from District 16. I have been for the last 16 years, and I'm currently the president of the Indiana Senate as well. The District 16 in its new configuration has all of Avoyt Township, most of Lafayette Township, if not all of it now, part of Lake Township, Washington Township, and about half of Wayne Township. So is a significant piece of our area here. It also has a little piece of Whitley County now, so that's a new portion of it, and I've been blessed to go to some of the meetings over there as well. And of course, as Representative Heuer said, been several times to the Passages organization over there. In the years that I have served, I have to say I recognize a lot of faces here today, and worked with many of you on various issues. I've been proud to do that. I think that, as Kathy mentioned, I've also seen Turnstone ARC, Anti-Wayne Services this year. We do that almost annually as we try to connect with those whose lives we impact, whether it be, in this case, the disability community or anyone else who we represent. And it's important to stay connected, and I'm proud that I've been able to do that and made the effort to do that as a legislator, as have really most of our delegation here. I think we all take pride in that. It's important to remember too, though, that as I looked at the number of these questions today, to keep in mind that a lot of them say, well, we've cut this or we've cut that. I do believe truly that we've done a pretty good job in Indiana in a bipartisan way in keeping our heads above water as we face the most difficult economic times since the Great Depression in this country. And we still haven't come out of that. But Indiana managed to keep its most important services from getting much, if any, cuts at all. We cut just about everything else, but we worked to protect Medicaid. We worked, obviously, to protect our K-12 system as best we could. And if you compare ourselves to other states, we did a pretty darn good job in maintaining services in the most difficult and dire circumstances, I would argue. And I'm proud that we worked together to our delegation up here on many of these issues. So keep that in mind as we discuss these issues today. I look forward to your questions, and very happy to be here. Thanks for putting this together, Sherry.
Good afternoon. I'm Tom Keene. I'm running against David here in District 16 for the State Senate. And as he's just described, the district has been recently realigned. It's pretty much the western third of the county, the western half of Fort Wayne, and goes into Whitley County. I'm a 20-year Navy veteran. I retired from the Navy in 2003 and entered the private sector, where I've been working locally here at ITT Excelis for the last 7 years. This is my first campaign. I want to emphasize that I probably disagree with a few of the things that David has just stated. We've made some deep cuts to very important programs, and I think some of those programs are represented here today. I look forward to your questions, and again, I'd like to also echo everybody else. Thank you, Sherry and David, for inviting us to attend.
Good afternoon. My name is Phil GiaQuinta. I am the state representative from District 80, which we're sitting in District 80. I was elected in 2006. Some of you may remember my father, Ben GiaQuinta, who served in the state legislature from 1990 to 2006. And one of the things I learned from both my dad and my mother was to do for those and help those that can't always help themselves. And it was a lesson that I took to heart, and I always will try and do that when I decide and how I vote on certain issues. Just to mention a little bit, I am on the Public Policy, Elections, Insurance, and Public Safety Committee. I'll be happy to answer the questions I think I've been assigned to, and we can get into a little bit more discussion about that. But I also just want to take a moment to obviously not only thank you for having us, but thank you for what you do every day with your occupations, or with the loved ones, or with friends that you help on a daily basis. Because it certainly isn't easy. I've had the opportunity, David, I don't know where he went, but certainly with the job he does at Lead for the Blind, it was a tremendous help to me personally. We were going through some personal issues at home, so I just wanted to thank him publicly. He's been a good friend, and it's a great organization. Thank you.
And Representative Moses.
I was the mayor when Phyllis was teaching kindergarten. I was not in her class, that's right. But I did know that everything I needed to learn in life came at kindergarten stage. And I had some beautiful ones too at schools from here. I just appreciate this session going on. I want to thank Sherry and David and Carrie and all for putting it together. In my career, I have tried to take this philosophy, and as we make the economy as good as we can, we try to create opportunities so that people can have work, so that they can have ways to earn a living. And most of the citizenry, given a chance, will do well. But there are some who, through no fault of their own, cannot do that. And I've come purposely to many meetings. The fetal alcohol syndrome one was one I remember most from a couple of years ago. Until you talk to the parents of the people that are dealing with a child like that, it's hard to understand. And it's important. Whether it's the Anthony Wayne Center, whether it's Turnstone, whether it's ARC, Steve Hinkle's been a long-time advisor. He's retired now, but I still go to him for advice, I have to say, too. There are things that we have to do in this world, and helping people with disabilities is the reason for civilization. It's the reason for having our communities, so that those people can have a chance. I try, as and everybody's pointed out, it's not been an easy time, and we've had cuts and things, but what I try to do is speak up wherever I can, and like Phyllis, I'm on the Ways and Means Committee too, to say, be careful. Let's hold these cuts down. Let's try not to take them out of those that are suffering the most or are the weakest. And I will continue to do that. Thank you.
First, one candidate will answer a question, and then their opponent will answer the same question. We have 2 minutes allotted for each answer. The forum will continue in this manner until each candidate has answered 2 questions. As time permits, additional questions will be asked. Question number 1 is being read by David Nelson.
Last year, community mental health centers were notified that they would receive a 5% cut due to Indiana's ongoing economic hardship. However, in December, Indiana officials discovered $300 million in unaccounted state funds, and as of June 30th of this year, the state had a surplus of over $2 billion. Question is, would you support using some of these funds to restore funding to community mental health services?
It's a little ironic that we're next to the baseball stadium, because I feel like I've been thrown a softball question here. I don't think we've had our priorities in order. At the session that we had 2 years ago, the answer that everyone kept giving, a lot of us gave anyway, were we have to make sure that our priorities are in order. I don't think in this last budget, frankly, that we did have our priorities in order. We did cut several things, obviously education. I think the extra money, David, that you referred to could be going back toward funding of education, certainly health services, community-based services as well. The surplus that you've seen of $2 billion has basically been a result of cuts to the budget. In the past, and others can correct me if I'm wrong, but I believe in the 90s and early 2000, the deficit that had grown was due to essentially increased revenue based upon our employment figures, our employment numbers. So yeah, no, I think our priorities, frankly, are out of place, and I would love to see some of that money go back toward helping people. Just echo what Representative Moses said, it is always a better community when everybody is participating, everybody is working, and everyone's contributing to it. Thank you.
This is a yes or no question as written on the form, and the easy answer is yes. I don't think there is anyone sitting up here who would not want to put more money back into any of the areas that we had to cut last year. It's just an automatic, but the reality of it is, will we indeed have the revenues when we do budget again? One thing that we won't have an opportunity to see until the end of the year, and David can probably respond better to this, exactly when we'll be able to see it, is what the revenue forecast is. Right now, we have 2 gubernatorial candidates, one Democrat, one Republican, and they're both saying they want to cut taxes. If indeed we're going to be cutting taxes, then we're going to have even less revenue to deal with. So that's something that will play into how we make disbursements or appropriations once we do sit down and look at the budget. I do have some concerns about the mental health area. And that was the first part of this question. And some of my concerns come because my husband serves in a judicial capacity in a different county. But when it comes to him trying to help some of the people that come in front of him because they have mental health issues, there oftentimes is not money there for that help. And so instead of them being able to gain some kind of additional support for mental health issues, they are sent to the Department of Corrections, where they don't have the opportunity to enjoy a little bit of relief from some of the things that they're suffering from. So that will be one area I will be looking into and looking at, and perhaps I can lean on Phyllis a little bit on the Judiciary Committee with that concern, so that we can possibly have a little bit more appropriation going back into that area. Thank you.
In Indiana, thousands of direct support professionals, these are the individuals that are every day supporting people with disabilities in waiver services and other services throughout the state. And while these direct support professionals have enormous high responsibilities for the health and welfare of their clients, the education and training requirements are minimal. We require a high school education. A few years ago, there was a very vibrant project that the state, through FSSA, had initiated to provide certification training through Ivy Tech for direct support professionals throughout the state of Indiana. And it was very well received. It was an online training and direct training. And it had to be cut as part of the recessionary cutbacks that occurred 4 years ago. And it did prove to enable many of the direct support professionals to get the kind of training that they need to effectively work with folks so they can make the best choices in their lives and have the best lives possible. Would you support the state setting educational and training requirements that include certification? And these are certification industry requirements that workforce development would recognize. And the training resources, again, to upgrade those requirements for the direct support professionionals.
Well, I appreciate the question, John, and I would say absolutely. Direct support staff, if it's necessary, that they require specialized education in order to interact with these folks and give them the need and the care that they require, I would be absolutely in support of that.
Good afternoon. Thank you all for being here. Currently, the unemployment rate for the general population is around 8.2%. In fact, the most recent numbers, I think, maybe a bit higher than that. However, the unemployment rate for people with disabilities is nearly 10 times that amount. What can state governments do, and private industry, to reduce this disparity and create employment opportunities for people with disabilities?
Well, as I mentioned, I think a lot of us here have done this. I've visited a lot of the different facilities around town. Most recently, ARC, and I'll tell you, watching the operation of people in the back, which they have that back area where they work, and the joy that they take, and the satisfaction, and the pride in working, and the fact that they are doing something meaningful and can save a company money by doing this subcontracting, whatever the job is, was a tremendous and enlightening experience for me, I will say that. And there is a definite opportunity and role for disabled people to make a difference in the economy, to help keep jobs here, and to do some of the tasks that would cost other companies more if they shipped it or out to some overseas, for instance, where some of these tasks might be done for less expensive labor. We are working to help disabled people get jobs. There's a vocational rehabilitation program that helps place people with disabilities in the workforce. In the past 5 years, 22,000 people have been placed in the workforce. The corporate development unit works to establish relationships with employers and disabled individuals. We also have a youth program called Project Search, creating internships for disabled young people. So there are programs in place. We can certainly do better, and we should. And I will say I strongly support the programs. I strongly support doing everything we can to reduce unemployment for all, including the disabled community. And I agree with Winfield Moses, who said the best way to do that is create a good economy. We're doing everything we can to do that in Indiana. Put programs together, I think, makes us a very attractive place to bring a company and to create jobs here. And I think it'll help all of us if we stay on course and continue with the programs we have in place. So, thank you.
Thank you.
Well, I'm going to have to do the Win Moses things. I agree with what David said, and I agree with what Win said here. We also need just one other additional thing, was we need to make sure that we're enforcing the Indiana discrimination laws that are on the books. And if we're not enforcing those, we need to make sure that we're making an effort. But all the other things he said I'm fully in agreement with.
I've thought about this, they gave us some of these questions ahead of time. And of course, the real first best answer is a booming economy, making sure that everybody has good jobs. In the periods in the late 90s when unemployment was down in the 1 and 2%, a lot of people with disabilities were able to get jobs. Everything we can do to help the economy, and we may speak about that further. But in addition to that, we need to help the Anthony Wayne Services, the Turnstone, the ARC. They produce a lot of working people and give them a routine and a career that is very beneficial. And I would like to add too, I think in the private sector, as I examine this, one of the things that we could do is give tax credits to those people that hire disabled people. So it takes some careful calibrations, but in fact, if we're paying already for those disabilities in some fashion, if the work would in fact substitute for that, we'd probably come out ahead, because when everybody's working, we're all better off. So those are 2 or 3 ideas. Thank you.
Thank you.
I don't believe that the government's job is to create jobs, but I do believe that creating an environment in which employers are incentivized to hire people that can do the job at hand and to do the work that's out there and available, I think is a job that we can do as a government. We can create tax incentives and avenues for which employers are encouraged to hire those that can be a productive part of society.
Currently, over 20,000 people are on the waiting list for Medicaid waiver services. Some have been waiting for over a decade. Would you support increasing funding for Medicaid waiver services? Are there other areas of government spending you would consider cutting to free up funding for Medicaid waiver services?
Yeah, let me just answer the second part, because we would all love, as Senator Long said, if we could, we would love to increase these, I'm not going to touch the mic, increase these services with no questions asked. We would love to be able to do that. Problem is, where are we going to receive the money? So I think we have to do some serious thinking of where we might find some money. For example, we do give a lot of tax incentives for businesses, which is typically you would think is a good thing. I happen to think that is the case, but there may be some areas where those incentives aren't working. There was I cited a study earlier, there's another one, and the Pew Research Center reported that Indiana's been trailing behind the rest of the states in evaluating the effectiveness and the results of some of the job growth and tax incentive spending that we have initiated. And there could be up to $1 billion worth of tax incentives there that just aren't working. Those are some things that I think we could review and see. Maybe if they're not working, let's eliminate them, and that may increase some revenue.
The question was about making available waivers, more waivers for Medicaid. And I can say that I would be very supportive of making it easier and streamlining the process to make waivers available and making more waivers available for those who are absolutely in need of those.
A few years back, we had a similar difficult situation that they thought was unsolvable. It was for seniors. They was being able to get care in their houses. And we instituted a program called Choice, so that they could, in fact, cheaper, have people come and provide services there. Oxygen, health care, food. It costs about $6,000 a year to do that. It costs $30,000 to put them into the nursing homes. I helped spearhead that, pushed it hard. By the time we were done, we got that part through, and I was awarded the Legislator of the Year for seniors. I feel about the same way here. We talk about Medicaid waivers. The way that division has been managed is abominable. And in fact, it's hard to tell what money we have. They don't answer your phone calls, they don't return things, they bring in millions of dollars worth of new people to run it, and in fact it doesn't work. If you try to call it, doesn't go through. They now have a $500 million lawsuit. The state has just lost part of it, and we're out $40 million. Good management would take care of a lot of the money's available, I think, for this too. But I would very much try to find ways to add monies to this. I can't say which one I'd cut, because I'm still trying to figure out where the $300 and $200 million came from. Thank you.
Well, it's sort of hard to follow when. I was always told that I shouldn't follow when. So let me just say that the short answer for me is yes. The waivers save money in the long term because they get individuals with disabilities to stay in the most supportive living arrangements possible. Forcing these members of our community to wait over a decade for assistance is obvious proof of inefficiency, as you just heard Wynn talk about. As far as areas to cut, areas of mismanagement in the criminal justice system, we heard Kathy talk about this just a second ago. Rather than wasting money sending people with disabilities to jail, let's use that money to get them the help that they need up front. And regarding cuts to other services, this is tangential, but it does speak to the management style and structure of the current administration. The mere fact of a backlog of processing Medicaid waivers demonstrates the inefficiency of the system. But I hope we have learned that the foolishness of seeking an easy solution to complex problems with the IBM outsourcing experiment would show us that there really are no easy solutions here. Thank you.
Well, first of all, it's hard to argue that there were some problems with the Daniels administration privatizing the FSSA intake. And I don't think I'll find anybody here that thinks that that worked out very well. And there are still problems with the system. And in fact, we're studying that. In fact, I believe on the 22nd of August, we'll be discussing some of the problems with the Department of Child Services directly. And where we can improve the system from what we're seeing today, particularly in the intake areas, which I think are very are failing at times pretty severely. I've met with a lot of people around this region who deal with children directly. They're concerned about it. I am too, as is leaders for all four caucuses in the legislature. I will say, however, that I do believe that there are efforts going underway right now to reduce the waiting list. I do think that the goal, for instance, I know that there's been meetings this year with advocates that come up with a report. There are efforts to change some of the waivers, support services waiver to a family supports waiver, replacing autism and developmental disability waivers with community integration rehabilitation waiver, all with a goal of better utilizing the funds we have and to reduce these lists. That's the stated goal of these groups. I think we're making progress. I do think that these lists can be honed down, and we're doing a better job, I think, today than we were. We'll have to do better yet. But I think progress is occurring, and we hope by 2017 to see some of these lists eliminated completely. So we have to keep focused on the fact that there is progress being made. There have been some mistakes made out there, and I think we're trying to hold those who made them accountable. But I also think that we'll make the system better because we are making that effort today. I think we'll have some solutions, some answers coming forward in the next session, particularly on the DCS issues. I don't think anyone here disagrees that we can do a better job.
The simple answer is yes. I don't think we have to cut for the other services because we don't know until, we'll budget next year in the long session, which is a 60-day session. That ends April the 30th. And we have a report from the financial people and the budget committee and the physical people that by March 31st, we will have a report. So in the Ways and Means Committee then, we take this report and then allocate to the different areas. And I think maybe by this next year, we don't have to cut, but we can reallocate. So I would be very much in favor of reallocating more money to the Medicaid waivers. And it's like Kathy said that some people are in the penal system that shouldn't be there because they don't have the adequate Medicaid waiver services. So, and in the long run, it is cheaper to address that problem there. And I was in the legislature also when the choice program began, and that's one of the best programs we ever had. That's the community home option of being able to stay in your own home, get your medical services paid for, and it saves the state money. And there may be other places where we can do things like that too, and it would just be a reallocation. Thank you.
State funding for public transportation has been largely via the Public Mass Transit Fund, or PMTF fund. which comes from a small portion of the state sales tax revenue. In 2011, the legislative session, that process was ended along with the distribution formula for that revenue. Would you be willing to support the restoration of the Public Mass Transit Fund with its distribution formula and to raise the funding for this vital state funding, for this vital state service to a full 1% of state sales tax revenue to support public transportation? And I would add that locally, our public transportation numbers have just gone up and up and up. Thank you.
We found in the last budget discussion, in fact, that the administration had proposed cutting public transportation funding somewhat significantly around the state. As we looked at all kinds of cuts, that was one of them proposed. We found that there was a tiny amount of money left at the end of the process that we could allocate money toward, and we restored the money for public transportation for the very reason you mentioned, that in fact we were finding with the tough economy that one thing was definitely happening was that ridership was up all around the state in all our counties. And the critical factor here, we want people to be able to work or be able to take care of themselves, get to the doctor. We need to make sure they've got a ride. And it's for some people it's tough to put gas in the tank. So ridership was up for a very good reason, and we supported that in the budget. But we did it with a line item. Fred's talking about a line item versus a direct allocation off the sales tax. And I guess the answer to that is we'll have to see what we've got facing us in the next budget cycle. What are our revenues? As Kathy mentioned, we have to know what our anticipated revenues are before we can start promising that we're going to spend more money here or elsewhere. Understand that we will not be taking serious cuts at public transportation under this next budget, in my opinion. I think it's important to maintain the funding we have. But will we increase it? I can't answer that right now. And I think in fairness, anyone who says they will, without knowing what the budget numbers are, doesn't know what they're talking about. So we'll have to wait and see. But remember also, when you allocate yourselves and tie yourselves to the sales tax and the economy goes down, your funding goes down with it as well. So there is that roller coaster. In good times, you're going to benefit more. In bad times, you may lose some money. So line item budgeting may in the end be the best way to go for many of our opinions. But maintaining that level of funding is also very important, in my opinion, as well.
Gosh, I agree with David here. This is amazing. Increased funding of public transportation is a win-win. There's absolutely no question about that. We provide better mass transit for people of disability or persons with limited funds to seek employment. We allow them to get out to work, which takes them off the welfare rolls or provides them with extra income. So it's a win-win. But there's some other wins there too. Increased mass transportation also decreases wear and tear on our infrastructure. And it saves tax dollars and makes everyone's commute more pleasant. Our infrastructure is underfunded, so this is sort of a deviation, but it goes right along with it. And it's in poor shape. 77% of our county roads are rated as unsatisfactory. Our bridges are rated a D+. Our state government has refused to allocate money for necessary repairs. So public transportation can help us slow down the decline of our infrastructure. It's a win-win.
As of June 30th, Indiana had a $2.1 billion budget surplus, the largest in the history of the state. This surplus was due in part to the $600 million in cuts to public schools. Would you support sending money back to special education programs?
Well, I've had many children that were special education children, especially autism, and I would favor more money for the special ed. But I don't like to make a point that I don't think anyone's been brought out, is the fact that over the past 20 years, we've had both Republican and Democrat governors, both Democrat and Republican House, and both parties. And I think we need to be very, very appreciative. They've been very frugal. And they've watched the money every budget session. Some states have just been very, very generous in their pension funds. They have given more and more money to their public employees, their policemen, their firemen, their teachers, the pension funds. Our pension funds are in good shape. We have a liability in the teacher's pension fund, but we have a way to pay for it. We have a new plan set up where it will be paid for. The state of California, and there are several other states, have a liability for every citizen of almost $4,000 for their pension funds that they owe. Indiana only has $38. So if you're a pensioner in Indiana, you're a lot more likely to get your pensions the rest of your life than you are in California or some of the other states. Because in some of the other states, they're going to have to cut a lot of things.
You are absolutely right. We have made deep cuts in education, and our schools have done an amazing job struggling with those lower numbers and trying to make all of their programs work. And unfortunately, they have had to make major cuts. What I do support is putting additional funding back into education, but not making those decisions for the schools where they put that money. I would sincerely hope that school boards and school administrators would take a hard look at where they made the cuts, and if it's in special education or if it's in the music and arts program, if it's wherever it is, that they would see where the need is highest and then reallocate those dollars back into those areas. I know that special education has deeply suffered, and I would certainly hope that our administrators and school boards would look that direction.
My simple answer is yes. I would love to see that those special needs children, providing them the support and the knowledge and teaching to be a success in life with their conditions, I think is an important thing of our public schools and all schools. And so I would love to see a portion of that be used for that program.
The budget has been particularly challenging in the last 2 years, and we've had, as everyone in here knows, dramatic cuts, and much of that has come from education. We won't know what the new budget is going to be for another few months. The most recent release said that we're about $100 million ahead of where we have been. I wouldn't get overly optimistic with that, but I think that's certainly headed in the right direction. A number of you have said that we need to be cautious in this process, and I think that's very true too. We don't know that we're done with the recession. I mean, as Senator Long pointed out, when you live by the sales tax and sales income, when it goes down, you're hurt. And in fact, education is now pretty much a state-funded situation, and one of the reasons those cuts have come down is because of that. I do, though, think that when we get the monies ahead, we should replace the monies that had been there. It's not just a short answer, yes, it's how do we do it. And I'm hopeful that we'll have more monies in the next session, because I think we're pushing forward well in many areas. And I think that when we get there, special education should be one of the special places that we look to provide, and understand that they're great need. As Kathy Heuer said, the school boards really need to make these. We make them individualized. Fort Wayne has a school board, East Allen County, Weatherly County, so that they can make their needs. And some have a lot of special education needs, and some do not. So I don't think it's fair to try to mandate it in any fashion, but I think the money's being available would be very helpful and very important.
I have an additional question, which I think kind of feels like the elephant in the room. We want to know whether or not you're going to vote to reduce lower taxes next year. Should the next governor want to reduce them?
I'll answer that. Be happy to. The answer is we're going to have to see what our revenues are, because I'll tell you, Indiana right now is very dependent upon gaming revenues as a piece of its overall pie. You know, I didn't vote for this, I wasn't here at the time when it came in, but I'll tell you, it has become a key piece of our revenue sources, and it's going down because they're putting casinos in Michigan already. They're due to come in Chicago. They're coming in Cincinnati and in Toledo, and believe me, we set our system up to take money from those states. We put them on the borders. They're getting their revenge now, and that means our revenue is going to go down. And so we have to seriously look at our current revenue sources. Are they adequate? Two, what's the economy going to look like? We have to look at our forecast and determine what's going to happen in Europe. All these factors that have nothing to do with the United States right now can impact our economy and our revenue sources. So for anyone to say, I'm absolutely going to vote for a tax cut, I think that's irresponsible until we know what we're facing here. And I think that all of us here at the table would agree with that. I don't think we're saying anything that would shock you. But Hoosiers understand very well that you don't spend more than you have. And one of the things we've been doing well lately, although it's been painful in some areas, is figuring that out and not going into deficit spending. And in the end, that will serve us well. As other states have huge deficits, we don't. And therefore, we're going to get healthier sooner than many other states. West Virginia won't get back balanced out until maybe 2019, they say. That's how tough it is for them. So we've done a good job of managing the budget, but we have to also be careful that we don't get overzealous in cutting our revenue sources, because if we're wrong, we're going to be off to cut services even steeper than we saw in the past, and that would be tragic. So prudence means you don't spend more than you have. You also don't cut your nose off to spite your face. We're going to have to be careful about this as we go forward. We'll just see what comes. I hope that answers your question.
No, go ahead.
Yes.
Might not just take a second.
Okay.
I agree.
I just have to say, I'm actually surprised that the attitude here from Mr. Long, and applaud the fact that he says we should take a wait and see. I also agree, we don't know yet, so I'm not advocating any cuts or any increases to taxes at this point.
Sorry for the redundancy, but I agree. We do. It's the prudent thing to do. We can't make decisions until we know what we have. Thank you.
As it was originally passed, the Affordable Care Act required states to expand Medicaid enrollment to all households with incomes at or below 133% of the federal poverty level, or lose all federal Medicaid matching money. However, in the recent Supreme Court decision, the court ruled that the federal government cannot use withholding funds to force states to expand Medicaid enrollment. Do you support expanding Medicaid enrollment in Indiana, or do you think the state should opt out?
You know, it's been talked about up here today that we have an issue with the people deserving of Medicaid and getting on the Medicaid program as it exists today. I don't believe expanding it would help that. I think it would create longer lines. To the extent that we are able to get our current program in order, get the waivers, people off the waiver list, I would not be in favor of expanding. But I would love to see a plan for it if it's fiscally possible to do such.
Thank you.
I think this has been the big important question, especially here in Indiana, since the Supreme Court decision on the Affordable Care Act. And I have to echo what Senator Long said just a few minutes ago. Indiana has been very frugal and very smart with the way that our budget has been laid out, and we've tried to stretch every dollar that we possibly can. And I just can't say today in front of everyone, based on some conjecture of what the 2013-2014 budget will look like, that I would be for expanding the Medicare rolls in Indiana. While I would like to see more people to be able to take advantage of some of these programs, being fiscally sound and fiscally responsible takes precedence in this situation. So without seeming to dodge on the question, I just think that it's too early to tell. There's going to be a lot of committee hearings and a lot of questions that need to be answered on this in the next session. And I would look to see this being one of the bigger issues in the next session that the legislature will tackle. Thank you.
Yeah, I would be happy to answer the question. I do support increased access to health care for all Hoosiers. And if that is Medicaid or any other alternative, I certainly support that. I happen to believe that Medicaid is really one of the best options that we have today. I saw a report recently that the Kaiser Foundation did, and they found Medicaid, frankly, to be more effective than our own Healthy Indiana plan. Certainly, we want to do, and the legislature needs to do everything we can to eliminate any sort of fraud or waste. But certainly, I do support the increased access of Medicaid, and would hope that folks would embrace Medicaid like many seniors have embraced Medicare. So I do support it. Thank you.
the Affordable Care Act is very complex. Some of you may remember it has 1,600 pages. And I once actually drew those all down and started through them and read most of them. By the time I was done, it was all changed, and it was up to 2,200 pages. So it is a complex study, but the Affordable Care has the principle that everybody is entitled to good health, that we should have good care, and we should be able to provide for it. That if in fact you lose your job, you shouldn't lose your insurance, so therefore if you get sick, you end up in bankruptcy. Or if you happen to have a divorce and you don't have insurance and suddenly you're living out in the streets afraid. That's the effort behind this. There's going to be great debate. As we've talked about, we have summer study committees and others, and this decision will basically be made by people at a higher pay grade than most of us, except perhaps David. And in this situation, all the way over there. But the governor has asked the two aspirants for his position to give him advice on how this should work out. And we'll see what they say. I do say, though, that Medicare has worked pretty well. Most seniors like that. And a well-run Medicaid system works pretty well. And as Representative GiaQuinta has said, this appears to be a better system than the Indiana system. So it's certainly worth consideration. And I'll leave you with this thought. If we don't do this, what do? Do we just abandon these people? Well, in fact, the monies for this, for the first 3 or 4 or 5 years, are pretty well covered by the federal government. If we don't take it, it doesn't mean we're saving dollars. I want to point that out. Those dollars will just go to Atlanta and San Francisco and the other cities. The worry is that we won't have money when this in fact ends, or the federal dollar stops. That could be. And that's what we're trying to consider at this time. But I think it's very important to provide a means for people to have health care in this world, because most of the bankruptcies that we see, most of the situations without health care are pretty desolate, and we're not doing some of the things we can do to help them. Thank you.
We've talked about the realities of the need for additional Medicaid. The reality is also, how do you pay for it? I had a really interesting conversation with State Representative Jeff Espik, who is the current head of Ways and Means, just 2 weeks ago. And he had just come from a meeting at the state level where they're taking a look at the new Health Act. And he said, if they do open it up according to the way the act is written now, just in Indiana, we will have well over 400,000 people new people who will qualify for it. I have no idea how we can afford that as a state. So what I'm looking for, and I know it's going to be one of the biggest debates that we're going to have in 2013, what I'm truly looking for is someone or some group of people that understands every aspect of that act. Someone that can put a plan together and say, okay, if we go this direction, here's how much money we'll need to raise, here's how we can afford it. If we go this direction, here are the possibilities this direction. I think what we're looking for is a lot of people at the state level with a lot of common sense who understand what the new act is going to provide for and what it won't provide for, and try to find a way for the state of Indiana to find their way through that sea of information. Again, it's a lot of information.
Okay, so the short answer is that I think we need to study it. And I think we've heard everybody at this table, with one exception, say that. And one exception is Mr. Long. The day that the Supreme Court announced their decision, he came out in a press release and said Indiana should reject Medicaid expansion, flat out. So he's in disagreement with the rest of the people at the table here, and I just want to point that out. I'm in favor of a measured approach to make sure that we've done the studying, that we've got the answers from all the experts. And as we examine the opportunity for Indiana, we may find that we need to accept parts, or accept all, or reject all. But we need to do the studies. We can't jump to an immediate political position, rejecting the opportunity out of hand, out front, without the proper study. And we need to make sure that Indiana medical providers who are currently suffering the burden of uninsured and underinsured folks are accounted for in this study.
Yeah, I will tell you why I said those things. And I said we most certainly will, or we are most likely to reject it. Obviously, it's my opinion, and the legislature has to make that call. But the Daniels administration and experts, outside experts who've been hired, say it could be a $2 to $3 billion increase to taxpayers in Indiana by the year 2020. And that is a certain tax increase on everyone in this room. Not rich people, not poor people, everybody. That's a problem for Indiana, and it's a problem for all the states. That's a freight train coming down the tracks for all of us taxpayers. Is there any question that we can do a better job of providing health care, particularly to our less fortunate individuals in this country? Absolutely no question whatsoever we can do a better job. But how do you do it, and that's the question. And I would argue, if you look at the Healthy Indiana plan that Indiana has in place right now, if that were to be changed so that we took a waiver, which is required now, we have a Medicaid waiver today that helps us fund that. And we use the cigarette tax increases also to fund that. There's a lot of money there. If we change the program to get in line with the Medicaid waiver, and we drop the qualifications down to 133% of the federal income level, or federal poverty level, which HIP right now calls for 200%, we would still have a significant number of people increased on the rules of the Healthy Indiana plan, and we'd have a way to pay for it if we rolled those tax dollars into that plan as well. It would be a much more frugal and more, I think, appropriate way to spend our money. I do not want to raise taxes on this country. I think Obamacare is in danger of crippling our economy. Yes, we can do a better job of health care in this country. No question about it. I don't think that's the right answer, and I certainly don't believe in raising taxes on the people of Indiana, nor does anybody else here, except maybe my opponent. But I don't agree in doing that, and that's a certainty that's going to happen with the Medicaid opt-in. Absolute certainty.
Thank you.
Would you be in favor of creating a state statute specifically designed to create jobs for people with disabilities in Indiana?
I don't think we can create statutes directly to create jobs for anybody. And let's understand, as we've all said, the purpose of government and economic development is to create opportunity so that people have a chance to go out and earn a good living. What I originally suggested, and I think this may have some merit, and I'd be happy to work for it, is that we give tax credits to those companies that do choose to use people with various disabilities. In essence, I think we'd be saving money, and perhaps we'd have to do some study to be certain of it, but if in fact they're working and generating tax paying, that would compensate for any of the monies that we would give, and I think everybody would be better off. But that's different than requiring a mandate from business in some fashion. That's probably never going to get past the legislature or anything else. But what we do need to do, and it's been pointed out here too, is not just that. We need to make sure that those people that are working at ARC and at Turnstone and at AWS and the rest, that those programs are expanded so that in fact there are more opportunities with people that understand how to make things better, how to make the economy work with disabled circumstances and give the disabled workers a good life, with earning money, taking things home too. And in many cases, and I've walked through most of them several times and talked with the people and watched them mature and watched them grow and met people that are there and seen them on the buses and talked with them, that's of immense help to us. Those are the kind of approaches, balance, that I would suggest.
I am uncomfortable with the idea of government picking winners and losers in any area. I believe opportunity is the answer, really no matter what the issue is. I would love to see tax incentives, tax breaks, encouragement for businesses who have the kinds of jobs available for those with disabilities. Give them incentive to hire those people and give them a meaningful job with a meaningful wage. So not picking winners and losers, but creating incentives for those businesses would be what I would be in favor of. Thank you.
Thank you.
After you get back to your it must be exciting to have you.
You don't have a very admirable job. What do you think? We do all right as a committee? Well, not everybody has. So that's pretty simple. Really, yeah.
want a picture. I'll be right back. I want a picture.